Yeah, it is different. It is different. And listening to the panel this morning, I thought there was, an enormous amount of wisdom already there with the experiences that that people have had using public online feedback already in Australia. I think for us, what drives us is trying to think about this not just from the perspective of organisations and staff, but actually primarily, first of all, from the perspective of citizens. So I think that's something that doesn't always come naturally to health service staff, clinicians, and so on. They used to think about patients, but think about citizens, thinking about people who need to share their experience, who want to help the health service, who feel that something went well or something went badly, and they want to make a difference. So starting from that perspective leads you, I think, to create a different kind of system from the things we've been used to. Obviously, we're all familiar with the traditional forms of feedback in health services here in the UK. We have, annual patient surveys at national and often at local level. We have something in England called the Friends and Family Test, which is a kind of a net promoter score. Would you recommend kind of a thing? We have complaint systems and so on. These are not always it often seems to me that these are designed with the organization in mind or with policy in mind, but not necessarily something that directly serves the citizen in a patient-centered, person-centered way. And I think that's what we're learning, I think, and it's been a bit of a surprise to us, perhaps as well as to everybody else, is that it is possible to build something which patients and families really like as a form of feedback and really value, because they feel equal and respected and able to engage in a way that's not onerous or threatening. And yet staff really like it too. And I think that's been the surprise, that it is possible to build something that everybody can get something out of. So it's not just serving a sort of, feeding the beast of organizational data systems. It is actually serving a wider public purpose. So that's the thing that we're, that we like, and that guides us in continuing the journey, really.